Welcome to the State Health Registry of Iowa's video training series. My name is Lori Summers. I'm the trainer for the Iowa Cancer Registry, and these presentations will cover any details for cases diagnosed 2018 and forward. This introduction portion covers the anatomy, primary site, and histology of the urinary tract. The urinary system produces, stores, and eliminates the urine waste from the body. This system includes, as primary sites, the two kidneys, the left and the right, the renal pelvis and ureters, again, the left and the right, the bladder, and the urethra. You can see that I have colored the slide and the slide previous with red and green to highlight the difference in cell type of each of these areas of the urinary tract system. Note I have separated out the renal pelvis part of the kidney, which is also colored green like the bladder, ureters, and urethra. And I'll explain more about this difference in the following slides. The traditional definition of the upper and lower tracts of the urinary system were broken down and indicated here at the top of the slide, with the upper tract referring to the kidney, renal pelvis, and ureter, while the lower tract traditionally was referred to as the bladder and the urethra. However, since kidney is a glandular organ, and unlike the other urinary structures, which are lined by urothelium, you will find that the Solid Tumor Rule Manual divides the urinary tract system by these cell type differences, rather than by the traditional view of the urinary tract system. Urothelial carcinoma originates in the urothelial or transitional cells, which line the urethra, the bladder, ureters, and the renal pelvis, and it has two major subdivisions, the papillary and the non-papillary. I will also approach this training material by grouping them like the Solid Tumor Rule Manual. The kidney parenchyma has its own set of rules, and the urinary includes the other sites of the bladder, renal pelvis, ureter, and urethra with their own set of solid tumor rules. So in this presentation, I'll first start by reviewing the primary sites of the bladder, the renal pelvis, the ureter, and the urethra. I group these together because the common thread is that they are all lined by transitional epithelium, or the more current preferred term used by pathologists now is urothelial or transitional cells. Then, later in this presentation, I'll speak about the primary site of the kidney. 90% of the bladder tumors are urothelial carcinoma. Another distinction between the two, the kidney parenchyma and the other urinary sites, is their function. The function of the kidney parenchyma is to filter the blood, removing the urea and creating the urine. Then the rest of the urinary system, the bladder, renal pelvis, ureter, and urethra, these sites all collect and transport urine from the body. A typical healthy adult bladder can store up to 2 cups of urine for 2 to 5 hours. All of the primary sites in the urinary system, bladder cancer will be the most common, and in fact, bladder is the 6th most common cancer overall, and men are 3 times more likely than women to get bladder cancer. Kidney cancer is the 8th most common of all cancers. Looking at some anatomy slides next, you can see on the left, shown here with the blue arrows, the location of the bladder and the ureters in relation to the major artery and vein, the liver, and the colon. The bottom part of the kidneys are only visible here since the transverse colon has been removed. The picture on the right then shows the view with the anterior organs removed, revealing the full kidneys. The concave area in the midsection of the kidney is the location of the renal pelvis area, and the blue arrow points to this on the right. This picture of the kidney illustrates in the green shading the area of the renal pelvis and calyces, which is the urine collecting system of the kidney. The darker area shows the upper part of the ureter, which is the narrow tube that carries urine from each of the kidneys to the bladder. Muscles in the ureter wall tighten and relax, forcing the urine downward. About every 10 to 15 seconds, small amounts of urine are emptied into the bladder from the ureters. This anatomy picture shows the urinary system in yellow and the relationship of the kidneys below the diaphragm and protected by the 12th rib on the posterior side of the body. I'm always surprised when I look at this picture to remind myself how high up the kidneys are located. Also note the adrenal gland is pictured here on the left side of the diagram. The adrenal glands are bilateral and they're located on the superior, very close to the top of the right and left kidneys. So basically they kind of sit on the top. So this slide shows that well. Also picturing the main vessels, the aorta and the vena cava. This slide shows the bladder location with the female and the male anatomy. One big difference is the length of the urethra between males and females. The females, of course, with the shorter distance from the bladder to the outside of the body. Here's a closer view of the female bladder. Notice no prostate here. This picture shows the placement of the ureters and their openings in the bladder. These two openings on the left and the right are the ureteric orifice. Note how they empty into the bladder lower down into the trigone region of the bladder rather than in the upper dome of the bladder. Oops, I need to back up one. This trigone region is described as the triangular area from the two ureteric orifices and the urethral orifice at the bottom of the bladder, also called the bladder neck. The trigone area is highlighted here in green. And the trigone is also the base of the bladder or the floor of the bladder. In the solid tumor rules, there's a section to help you code the primary site. Now we'll get to this slide. So here, the male anatomy shows the prostate gland with the urethra passing through. This slide is also nice to show the ICDO codes of the specific subsites of the bladder primary site codes, such as the dome, the lateral wall, the anterior wall, and the bladder neck. You may be wondering about the urachus located at the top. The dome of the bladder is all about. It's code C67.7. I don't recall ever coding this as a primary site for a tumor. It is a remnant from the fetal bladder that joins and runs within the umbilical cord to drain the bladder. So here's a little bit of trivia. According to the dictionary, it is a solid cord structure and it is a functionless remnant having to do with that umbilical cord in embryologic development. So just a little bit of trivia. Okay, moving on to the anatomy of the kidney. We're going to focus on the renal pelvis. Here you can see that in green. So this is the urine collecting part of the kidney. The primary site code for renal pelvis will be 65.9, and there, of course, is laterality coded to this site since we have a left and a right kidney. Other parts of the renal pelvis, seen here in green, are the calyces or the calyx and the minor calyces. And so these are also coded to C65.9. Note the renal vessels shown in the picture and how they enter into the kidney at the hilum of the kidney. This is similar to the hilum of the lung, where the bronchus and the vessels enter the lung parenchyma. So hilum is an area. Think of it as a area, both in the kidney and the lung. This slide shows a cross-section of the kidney at the midsection. Also illustrates for us the location of the hilum to the renal pelvis. So the hilum is the space on the inner side of each kidney. It's a concave notch where the renal artery and vein enter the kidney. The white colored area in this picture shows the renal pelvis and its function as a funnel for urine flowing into the ureter. The other gray part with the blood supply shown is the kidney parenchyma. Another term you might encounter when dealing with kidney primary site would be the renal sinus, which describes a space or a region outside the kidney which contains only fatty tissue. So here, within the line drawn from the medial edge of the upper pole and the lower pole of the kidney is the renal sinus. Other terminology you may see used regarding the kidney is reference to the upper and the lower poles of the kidney. Basically, this is just dividing the kidney in half, as shown here in this picture. Again, here in this slide are the primary site codes for the urinary tract system of those sites which are lined by urothelial transitional cells. Bladder has many subsites ranging from the C67 to 67.9. The renal pelvis is one single code, 65.9, and includes all of the descriptive terms listed there. The ureter and the urethra each have their own code listed on the slide. Here are some specific guidelines for coding the primary site for bladder in the solid tumor rules urinary section. Refer to the priority for coding primary site for these codes C678, C679, and 689. This defines in priority order. So if one of these rules applies, stop. You don't go to the next rule. So let's look at number one, coding the overlapping lesion of a urinary bladder. So this is one lesion that's big enough to overlap different subsites, which is what 1A states. 1B is a single tumor or discontinuous tumors, which are urothelial carcinoma in situ, and it involves only the bladder and one or both ureters. There are no other urinary sites involved. So basically this is a single overlapping tumor, but 1B does allow for discontinuous tumors in situ if it's in the bladder or the ureter. Going on to C679, item 2, when there are multiple non-contiguous tumors within the bladder and you don't know the subsite. So this is when you have a scope and it says there's multiple tumors. This would be the best primary site. Moving on to 3, code an overlapping lesion. Again, we have one single tumor to 688 when you have a single tumor that overlaps 2 urinary sites and you don't know the origin. So the urinary sites could include a tumor big enough to overlap the renal pelvis and ureter, or the bladder and the urethra, or the bladder and a ureter. This is different than up above because 1B is only for in situ. So then we have rules for when to code urinary organs. There's one more rule, 689 for multiple tumors, multiple discontinuous tumors in multiple organs within the urinary system. So if rule 3 doesn't cover what you have, then you would go on to rule 4 and code the C689. Let's review the typical histologies found in the bladder, renal pelvis, ureter, and urethra. The most common type found will be the urothelial, also known as transitional cell carcinoma, since these sites are lined by urothelium. In the past, the term more often used was transitional cell carcinoma, or TCC. These terms mean the same and they are coded the same. However, you may also find the term papillary used along with either urothelial or transitional cell carcinoma, and that is a description of the shape of the tumor. More about this coming up in the next slide. Other less common histologies of the urinary tract are the squamous cell carcinoma and very rarely an adenocarcinoma. If you ever see an adenocarcinoma in the bladder, first question if it's coming from the prostate. Likewise, if you have an adenocarcinoma in the renal pelvis, make sure it is not a renal cell carcinoma of the kidney parenchyma with extension into the renal pelvis. That scenario would be more common than for an adenocarcinoma to occur in a urinary tract. From the Solid Tumor Rule Manual, these will be the most common histologies that you will see in the urinary system. Remember that the first column shows the NOS code, the second column shows the synonym, and the same code as the NOS. The third column is where we need to pay attention if we have a subtype variant of the NOS. Micropapillary urothelial carcinoma is a subtype variant and is more specific term than the urothelial carcinoma. We know that is important now when coding the most specific histology if it is described as a subtype, type, or variant. These 4 pictures illustrate the papillary versus the flat carcinomas of the urinary system, which arise in the urothelial tissue. Both papillary and non-papillary urothelial carcinoma can be either an in situ or an invasive. Code the behavior specified in the path report. A papillary tumor does have a different histology code than a non-papillary or a urothelial carcinoma. Take note of Table 3, which shows the non-reportable histology terms. If you look kind of toward the middle bottom, the 8130/1, you might also see this written out as PUNLMP, punlump. This is not reportable. So this is a handy list if you come up across something as your case finding and you wonder if it's reportable. I appreciate those tables. Grade table 19 applies to all of these primary sites. And as you know, your software will pull up the correct grade table. There are some notes for grade for these sites. Note 3, the priority order for codes for urothelial cancers. Use codes L, H, and 9 listed here in the blue. If all you have is a grade or a G1 through 3, then your grade would be 9. The adenocarcinomas and squamous cell carcinomas listed here in orange, codes 1, 2, and 3, and also includes 9. If all you have is an L or an H grade for adenocarcinoma or squamous cell, then you would code a 9. Note that grade 3 includes undifferentiated or anaplastic. And note 5 tells us that for bladder, a TURB qualifies for a clinical grade only. Okay, back to kidney. We're going to focus a little bit on the kidney anatomy, the parenchyma. So that's the body part of the kidney, the glandular part, which filters the blood and produces the urine. You may have seen diagram pictures of the filtration process of the kidney shown here on the right, but the details are not really that important to our cancer abstracting. However, it is important to understand the difference between the renal pelvis part of the kidney versus this filtration region of the kidney, the parenchyma, or another term you might see is kidney nephrons. So in this next section of the presentation, I will focus on the parenchyma part of the kidney shown here in the dark area outlined in pink on the left. The primary site of the kidney has its own section in the Solid Tumor Rule Manual, separate from the rest of the urinary system. Starting out with some anatomy slides, it is interesting to note that the kidney is shaped like kidney beans I use in my chili. Kidneys are about 4 inches long. They weigh about 10 ounces. And kidney cancer makes up only about 3% of all adult cancers. So you won't be abstracting a lot of these in a year's time. The majority of them are renal cell carcinomas. The term renal cell cancer in general is basically means cancer of the kidney. I'll discuss more about the histology in a few more slides. A similar anatomy slide that we saw before. The green arrows here are pointing to the kidneys again. On the left, this shows the lower pole of the kidneys in relation to the other organs. And on the right, the organs have been removed. And you can see in one kidney, the adrenal gland sitting on top. This is a cross-section of the abdomen and a good picture to show that the kidneys lie behind the peritoneum outside of the peritoneal cavity. This location is referred to as in the retroperitoneum or behind the peritoneum. So we are standing at the foot of the patient, looking towards the head, and they are facing up. Take a look at the structures which are around the kidney, labeled here in the center in the spinal cord and the vertebrae. And on each side of the vertebrae are the psoas muscles. Anterior to this is the location of the main artery and vein in the pink and blue. The kidneys are pinkish in color, or peach kind of in this picture. And you can tell the left side of the body because it shows the spleen and the stomach. Knowing the location of these organs will be important for staging and describing the extension of the kidney tumor when we code the extent of disease, and the SSDI if there is extension beyond the capsule of the kidney. This slide contains more detailed terms and definitions of the kidney anatomy. Looking at Gerota's fascia It is a layer of connective tissue between the kidneys and the psoas muscles, and this does affect our extension when we get to that point. So here we want to ignore the green area, which represents the renal pelvis and ureter, and instead focus our attention on the terms on the left in bold black, which relate to the primary site of the kidney C64.9. So as you know, coding the primary site is easy because there's only one code. Starting at the top, the cortex, the outer layer of the kidney parenchyma, which is a connective tissue layer, shown here kind of in grayish color. Next, the pyramid and the medulla area in brown is where that filtration takes place. Then you can see the outside layer of the kidney called the capsule, which is fibrous and tough. And then shown in yellow, we have the kidney surrounded by perirenal fat, which offers some protection of the kidney. The renal fascia is shown here in the lime green line, specifically named Gerota's fascia. The presence of this fascia noted in the path report will be important to document, since it will help indicate that a radical nephrectomy was done, and we'll point that out when we go over the surgical treatment for codes in the kidney schema. Table 1 in the solid tumor rule shows the most common histology for kidney tumors. Remember, column 1 is the NOS, column 2 is the synonym, and column 3 is the subtype variance. As you go through the rules, a lot of the rules pertain to a certain column or a certain row. So if that's confusing, sometimes it's helpful to number your rows so that you can remember when a row changes. That's the most important thing. So row 3 includes the sarcoma. Let's back up a minute. So row 1 includes the NET tumors, the neuroendocrine tumors or the carcinoids. Row 2 would be the renal cell, the 8312. You can see that the sarcomatoid carcinoma or sarcomatoid renal cell carcinoma is a histology that is a synonym to the 8312. And then looking at row 3 includes the sarcomas of the kidney. For the kidney parenchyma, grade table 18 is used. And there are a few notes. Codes 1 through 4 take priority over codes A through D. Note 4, the Furman grade is no longer used for coding grade for kidney cancers. If you have a Furman grade, you will code 9. I also want to point out that because the kidney grade table has A, B, C, D options, that means if you need to convert a grade using the generic grade table, you may do that. An example would be if you had a medium grade or a stated intermediate grade, you can see that that is not in this table. But because the A, B, C, D options are in this table, that allows you to go to the grade manual, page 32, and use the generic grade table. For the example that I gave, medium grade or intermediate grade would be translated to a code C. Remember, the other urinary sites use a different grade table, and it did not include the A, B, C, D options. This ends the introduction video. Pause the video and proceed through the slide handout to complete the short quiz. Use the table and rules in the solid tumor rule manual and code the primary site for the next 10 cases. Once you are done, you can resume the video to go over the answers. You may pause now. Okay, so let's go over the answers to these 10 exercises. And basically, we're coding the primary site. This one had discontinuous tumors involving the left ureter and the bladder. So we needed to go to our rule to figure out how to code the primary site. And Rule 1B pertains to this exercise. We do have a single in situ tumor, but we also have discontinuous tumors in the left ureter and the urinary bladder. So the correct answer is A. We would code primary site to C678 based on that Rule 1B. Okay, number 2. Here the tumor is on the left lateral posterior wall, and the TURBT confirmed that that is the location of the tumor. Based on Table 1, the term lateral posterior wall with a hyphen has a code of C678. This is specific because there is a different code of a lateral posterior wall with no hyphen that would be a C67.9. So for number 2, the correct answer is B. Number 3, the TURBT showed the lesion to overlap the right trigone and the right lateral wall. So here we have one lesion that's big enough to overlap 2 subsites. The correct answer would be C678, bladder overlapping lesion. Number 4, the 2.4 centimeter lesion is on the dome of the bladder. This one's pretty easy, so you can code this to dome, C671. Number 5, this is a kidney tumor. It showed an neuroendocrine carcinoma of the left kidney. We know there's only one primary site for kidney. C64.9 is the correct answer. This one, the bladder is completely negative except for a papillary urothelial carcinoma in the right hemitrigone. And so the correct answer is A, bladder trigone. Number 7, the papillary mass was on the right lateral wall. So the correct answer is B, bladder lateral wall. Number 8, the papillary lesion is over the left orifice. And so the primary site would be C, bladder ureteric orifice. Number 9, this one has a large bladder tumor. It looks like it encompasses a lot of sites. The entire bladder neck went to the right trigone and involved the anterior wall of the bladder. And so this tumor is large. It's overlapping a lot of area. And it was nice to have that note that the tumor surface area is likely 8 to 9 centimeters. So again, that's just another confirmation that you have one tumor that's large enough to cover a lot of this area. So the correct answer is D, bladder overlapping lesion. And finally, number 10. Here, the right wall, the left wall, and the dome of the bladder are all involved, but it does not state that it's a massive size tumor to overlap all of these areas. It's just stating that those areas are positive. We don't really know where this might have started, So the best answer for number 10 is D, the bladder NOS code of C679. This is the end of the introduction video for the urinary and kidney sites. If you have any questions, please feel free to email me. Thanks a lot.